Hi guys, welcome back to my YouTube channel. On today's video, we're going straight to talking about chest tube. What are chest tubes? This is what a chest tube is, okay? A hollow plastic tube that goes in between your ribs to remove air, blood, or fluid from the pleural space, and that is the space around your lung. Think of it as you building a house, right? And that house is flooded. There's like fluid everywhere. We need to drain the fluid to make sure the house functions good. You might be wondering, why would someone ever need a chest tube? You need it for pneumothorax, hemothorax. Pneumothorax is when there is air outside the lungs, causing it to collapse. Hemothorax, this is the collection of blood, or maybe after a heart or lung surgery. So this is what your chest tube looks like. Important things you need to know is this is your suction control, and this is your collection chamber. So this is where you see the fluid being collected, and this is your water seal chamber. This is your tube clamp. You have your air leak monitor here. Please take note, this air leak monitor, it could bubble continuously, but it should never bubble aggressively. When it bubbles aggressively, then you know that there's a problem. A chest tube basically recreates a negative pressure. It helps to maintain the expansion of your lung. A chest tube could be done at the bedside. It is usually really painful. You have to give your patient lidocaine, something to just like numb the pain, basically. It's a procedure, so the patient needs to sign a consent form, but the nurse is never in charge of explaining the procedure to the patient. That is not the work of the nurse. That is the work of the physician. But as a nurse, you could witness the signing to make sure your patient understands like what the procedure is going to entail. And you could also prepare the documents, get it ready. And for post-op, you want to observe the site to check the drainage, to make sure everything looks good. You could teach deep breathing exercises. Another really important thing you need to know about chest tube is it needs to be below the chest. Like, this is one very important thing because we are working with gravity. We are trying to pull out fluid or whatever from the lungs. We need that chest tube to be down so that way it just drags down. Also, we don't want any backflow back into the body because that's going to be really dangerous for our patient. If you notice, maybe you notice the fluid is not draining properly, don't strip it. Like, don't pull on the tubing to find out what's going on. Okay, you could kink it maybe towards the end. Just kink a small part for like a few seconds just to know where the blockage is coming from. Okay, also check your patient to make sure it didn't like pull off of your patient's body. Don't put it on the same level as the chest. Also, something else you need to know is if you have a chest tube and it automatically comes off from the chest cavity, you need to apply a sterile dressing immediately. We do something called a three-way occlusive dressing. Now, you must have this by your bedside with or without the chest tube coming off. You need to have that as like a preventative measure. So you put that to the chest cavity, but you tape the first side, tape the side, tape the side, but leave the bottom side open. So that way your patient gets to expel CO2. Also, if it's not from the chest cavity that the chest tube comes, if it comes up from the system itself, what you want to do is you need to have normal saline. You take the end of that, you put it into the water. Of course, you want to be calling your healthcare provider to let them know what's going on, call for help. Keep on checking your patient's status. Check your patient's vital signs every 10 minutes until your patient is stable. You want to monitor your drainage output every 1 hour initially, but then every 2 hours afterward. Mark the level on your chest tube system at least once per shift, possibly every 4 to 8 hours. If the output exceeds 100 millimeters per hour, you want to inform your provider or say the color changes as well. So we have the wet suction system and we have the dry suction system. The dry suction system has a dial. You remember it as D for dry, D for dial. You shouldn't see any bubbling at all in the dry system, but in the wet system, it's okay to see some bubbling. All right. And after you do all these things and you make sure your patient is good, you check the vital signs, you're good to go. And that's the end of this video. So I'm just going to ask a question here. Take some time to think about the answer and let me know. If you chose below the patient's chest level, that was correct. Okay, I'll see you in my next video. Let's think about chest tubes for the rest of this week. Bye.